In this video, we will examine three phases of an overhead tennis serve: the wind-up, hitting the ball, and the follow-through. The glenohumeral joint, scapulothoracic articulation, and the elbow joint will be assessed, including the motion that is occurring at each. We will also discuss the muscles that are at work during each of the phases and how they are performing during each phase.
To begin this activity, you will start with holding the racket in front of you. So the glenohumeral joint will be in flexion, the elbow in extension, and the scapula protracted and slightly upwardly rotated.
In the wind-up phase, the glenohumeral joint will become hyperextended, horizontally abducted, and laterally rotated. Shoulder hyperextension is the result of a concentric contraction of the latissimus dorsi and the posterior deltoid muscles. Horizontal abduction results when the posterior deltoid, infraspinatus, and teres minor muscles contract concentrically. When the infraspinatus, teres minor, and posterior deltoid muscles contract concentrically, the shoulder is then laterally rotated. Scapular retraction occurs at the scapulothoracic articulation. To cause this motion, the middle trapezius and rhomboid muscles act concentrically. The elbow is flexed in this phase. The muscles involved at the elbow are the biceps, brachialis, and brachioradialis. These muscles are contracting concentrically.
Phase 2 is hitting the ball. The glenohumeral joint will be in flexion and lateral rotation and moving into extension during this phase. The posterior deltoid, latissimus dorsi, teres major, and pectoralis major are responsible for this motion. These muscles contract concentrically throughout the motion. At the scapula, there is upward rotation as well as protraction. For this motion to occur, the upper and lower trapezius muscles must contract concentrically. The serratus anterior contracts concentrically during this motion as well. The elbow is in extension during this phase. The only muscle action occurring at the elbow during this phase is a concentric contraction of the triceps.
The final phase of motion is the follow-through. The glenohumeral joint is in medial rotation, horizontal abduction, and flexion, moving into extension. The muscles that cause medial rotation are the latissimus dorsi, teres major, subscapularis, pectoralis major, and the anterior deltoid. Horizontal abduction is performed by the posterior deltoid, infraspinatus, and teres minor. The posterior deltoid, latissimus dorsi, teres major, and the sternal portion of the pectoralis major accomplish extension. These muscles are contracting eccentrically since the arm is slowing down. The scapula is in a position of protraction and downward rotation. The serratus anterior and triceps muscles contract eccentrically to slow the arm down and to cause that protraction. The elbow is in flexion and the tricep muscle contracts eccentrically.
In conclusion, we have just demonstrated a typical overhead tennis serve and the actions that take place of the glenohumeral joint, the scapulothoracic articulation, and the elbow joint. We have also discussed the muscles that are at work during each action and how those muscles are acting during each. Also, the reason for the wind-up phase is because by moving your arm farther behind you, this motion stretches out the muscles acting at the glenohumeral joint, allowing a greater force when contracting.